Feeling sick? Could it be a cold, the flu, or COVID-19? Have you ever felt sick and wondered, is this just a cold? Or could it be something more serious like the flu, or even COVID-19? It's a common question, especially during certain times of the year when these illnesses tend to spread. Knowing the difference between these three common respiratory illnesses can be tricky because they share some similar symptoms. But don't worry, understanding the key differences can help you get the right treatment and protect yourself and others. Let's break down the common cold, the flu, and COVID-19 so you can better understand what might be ailing you. Remember, this information is for educational purposes and should not replace the advice of a healthcare professional. Always consult with your doctor or a qualified medical provider for personalized guidance and treatment. The common cold is a frequent visitor, especially during colder months. It's caused by a virus, and there are actually many different cold viruses circulating around. Most people recover from a cold within a week to 10 days. The common cold usually starts slowly. You might notice a scratchy throat first, then a runny nose and sneezing often follow. You might have a mild cough too. Some people get a low-grade fever with a cold, but many don't. While a cold can make you feel lousy, it usually doesn't cause severe fatigue or body aches like the flu often does. Rest, fluids, and over-the-counter medications can help manage your symptoms while your body fights off the virus. Unlike the common cold, the flu tends to hit you like a ton of bricks. It's caused by influenza viruses, and it can make you feel much sicker than a cold. Flu symptoms often appear suddenly. One of the biggest differences between a cold and the flu is fever. The flu often causes a high fever, sometimes over 101 degrees Fahrenheit, whereas colds usually don't. Along with the fever, you might experience chills, body aches, headaches, and severe fatigue. A dry cough, sore throat, and sometimes nausea or vomiting can also accompany the flu. It's important to rest and stay hydrated if you suspect you have the flu. Antiviral medications are sometimes prescribed, especially for people at higher risk of complications. Getting your annual flu shot is the best way to protect yourself from getting the flu. COVID-19, caused by the SARS-CoV-2 virus, is a respiratory illness that emerged more recently. It shares some symptoms with both the common cold and the flu, which can make it difficult to differentiate. COVID-19 typically causes fever, dry cough, and fatigue. However, some people experience a loss of taste or smell, which is less common with colds or the flu. Other possible symptoms include sore throat, congestion, headaches, muscle or body aches, and shortness of breath. It's important to note that COVID-19 can cause a wide range of symptoms, and some people may be asymptomatic, meaning they don't experience any noticeable symptoms at all. If you suspect you may have COVID-19, it's crucial to get tested and isolate yourself to prevent further spread. Vaccines are available and highly effective in preventing severe illness, hospitalization, and death from COVID-19.